I have one, actually. I have one, no, because Dr. Delay raised a dramatic topic, which is the social segregation. And I was remembering what you said, Professor Suru, yesterday in your opening remarks, that you want to be assured that women will no longer be the silent victims and unheard voices of substandard healthcare. How much is social segregation? I mean, that's a dramatic issue. The level of impact. While writing the press releases I did in this month, I discovered that most of, such as fistula, for example, obstetric fistula, a lot of diseases and HIV and AIDS, of course, have an impact on that. How is the burden? Please, the burden of social segregation.
I think to take that question and to conceptualize it, we have to look at the status of women worldwide. I think that all of that derives from the status of women. And I'll give you one example. I was health minister in Nigeria, at some point. And I visited a hospital, not in Nigeria, outside of Nigeria, but in a neighboring country. And I saw in that hospital a woman who had been in labor for 36 hours. And she was not offered cesarean section. And I wondered why. And I was told it was because of cost. And so we found money and paid for that cesarean section. But on deep interrogation, I was told she was actually abandoned by her husband, who felt that she was bringing bad luck to him. Yeah. And she abandoned her and went further and would go and marry another woman. That is totally unacceptable. Yeah. That means that that woman means nothing to him, and within the community from where he comes, women mean nothing. Now, so if we take it from the status of women and we build up, we actually then would see what is happening to women around the world. And it is not a developing country situation alone. It's both developed and developing. And so we need to raise the status of women everywhere. Equality, gender equality is key to everything that we do. I'll stop.
Maybe. I have another question.
Can we leave Dr. Bustillo to answer, or you want to? Okay, please. And then your question, sorry.
And just to add, answer your question, we need to work on the status of women. I completely agree with Professor Babatunde, but especially of young women, of girls and adolescents. Because for the audience, 10% of all the pregnancies that happen in the world happens in girls, in women that are below the age of 18. These girls do not have the knowledge, do not have the capacity to really make decisions about their own fertility. The law in the country allows them to get married, to get in that situation, and we know from the health point of view, they are twice as more at risk than women that are in fact physiologically and biologically developed when they actually give birth. And not leave it alone, they will also be parents that are not capable of providing for their offspring because they are not prepared for that. So empowering of women, and especially young women and young girls.
Thank you.
Talking about, I'm from the Netherlands, maybe that explains my question. Last week, a vote of women on waste, maybe known to you, was refused from Morocco. They do abortions for women. Do you have any reaction to that? Because I think it's
I didn't
capture, the beginning.
I didn't catch the beginning of that.
Yeah. You didn't hear
I didn't catch the beginning.
Okay, of the question. Well, the beginning is that I'm from the Netherlands,
yes.
which puts in a position. There is a vote, it's called Women on Waves. It's a vote where women all through the world can get an abortion if they need it, even though it's prohibited in their own country. My question is, it was refused last week from the Moroccan government. Does FIGO have any comments to that?
Was refused to birth?
No, they were refused from the Moroccan government. It's a boat that provides abortions for women.
That is, the boat was not allowed to go.
No, it was not allowed. What they do, they put the boat outside the territorial waters from any country, and then women can go aboard on another ship, go there and have their abortion, because that will lower the rate of mortality as well.
FIGO doesn't have any approach concerning this problem, and whenever a problem arises in the country, we always contact our member societies in the country and ask if they are aware of this problem, and if that problem is there, what are they going to do concerning this problem, and that FIGO would be very willing to help them to talk to their governments. We cannot interfere with the government policy directly, but we go through our member societies. And this happened, another example happened in one of the countries in Asia just about 8 months ago or so, where the Minister of Health issued a recommendation that female genital mutilation can be performed in hospital by medical practitioners. So immediately we contacted the member societies, and the member societies asked for our help. So I did write to the Minister of Health, addressing this problem and saying that we will be very willing to have delegates and go to the country and discuss it with the issue. But we, as an NGO, as a professional organization, cannot interfere in the policy of the country. Well, maybe WHO or UNFPA.
What we do at the World Health Organization, we work, as I said, on the norms and standards. So just after the spring, we publish the new version of our guidelines for prevention of unsafe abortion, and working with the healthcare professional organization, we are using them and disseminating them, and in many countries they're extremely useful, both for the providers but also for the policymakers. And as you know very well, every country has the issue of abortion is clearly regulated by law. So where applicable and where the law permits, then the service provision can be given. On this topic, what we look at is the need for the services where they are, because this idea of a boat, as merciful as it may look, in reality can only serve a very, very limited part of the population. And in fact, the policy dialogue and the change in the services that I provide to the entire population are really what we are looking for.
Oh, that's why they go there. They just want to start a discussion in a country over these issues.
I think it's important to situate the conversation. The United Nations, UNFPA, WHO, would insist that abortions in countries where it is legal are performed safely. That's the key. Where it is legal are performed safely. But I think the overriding principle, what Flavia said, but which we have to put in a granular form, is that women and girls must have access to contraception and family planning. If they do have it, and they have it, and I would insist that it should be free, because it's a right, then the need for abortion totally disappears. And I think that context has to be taken all the time.